Hi, today let me talk about what happens to our body, what happens to us actually physically after we have a surgery, especially after a major or a minor surgery. Always remember, a surgery is a kind of trauma. Now, it's a severe form of trauma in case of a major surgery. Why we go for a surgery? Normally, to take out something which is harming our body, like a tumor, a cyst, any malignancy, or even the non malignant tumors and cysts, or even a baby, which is nothing abnormal, through cesarean section. Cesarean section is also a major surgery where there is loads of blood loss and injury to the tissues. Now, as I said, that this means a severe trauma to the body, the human body, the patient's body. Now, we surgeons would never be able to do any surgery on anybody unless the body repairs itself. Once we do a surgery, after whichever reason we do it for, delivering a baby, removing a tumor or a cyst, unless the body repaired itself, we wouldn't have been successful. The patient would have finally succumbed to the severe injury. When I do cesarean sections to people and they ask me, Doctor, I have so much of pain. So I often joke, though it's a sort of a sick joke, but I say that, see, I have done a major surgery. I've just cut through your abdomen and many layers. So if you don't have pain, then don't pay me. So probably I haven't done anything. Yes, we go through different layers, cut through different layers to deliver a baby, and then we repair. How do we repair? We just stitch on the layers, approximate the cut end of the layers. That's normally done. Now, after that, the rest we depend upon the body itself to heal. And do you know how the body heals itself? It heals itself by the process of inflammation. Whenever there is an injury to the body, there is inflammation. For example, if you remove the dressings of a cesarean section within 1 or 2 days after the operation, that area would be highly angry and red looking. You would be very astonished to see that place. Actually, that is the inflammation which has happened. Through inflammation, new blood vessels grow, and through these new blood vessels, new cementing material, fibroblasts and fibrous tissue, they develop and they slowly heal the wound, approximate the cut edges to get a new layer. But always remember, what is done in surgery cannot be undone completely, and you will not get the same body which the God has given you before. Now, this repair process, however good it may be, there may be some over repair, formation of excess of fibrous tissue, which can lead to scar formation. Sometimes I enter an abdomen of a patient who had undergone a previous cesarean section or previous operation, and there is extensive scarring, and we call it extensive adhesions. The organs often get stuck together, different layers get stuck together, and this is because of an over attempt to heal. But sometimes, some people, this overactivity of healing never happens, and so you get a very clean scenario inside the abdomen after the previous operation. Now, this can be due to two things. If the previous surgery was not very well done, there was oozing of blood later on, this scarring, this extra fibrous tissue may be a chance formation because of this suboptimal or not a good quality operation. Or it may be sometimes the patient's own inherent excessive attempt to repair the injury, which can lead to these scarring and adhesions. So, when we go inside the abdomen of a patient who has undergone an operation before, we have to be always ready to face these excess over repair and deal accordingly. But one thing I stress at the end of this video is that unless the body itself healed, body itself repaired through inflammation, deposition of fibrous tissue, the cementing material to heal those edges, the cut edges, we wouldn't have been successful. Each and every operation would have failed. This is how brilliantly the Mother Nature works. If you like this video, please like it. And to know more about these sort of topics, you may subscribe this channel for free. I would be delighted. It would be a great help for me. Bye.